What is your situation then there in terms of bulk billing?
So we have moved away from bulk billing approximately 6 months ago now. We moved away from that after 3 years of consecutive losses in our business, or in my business. And that was also compounded by difficulty recruiting other doctors.
Okay, so if you hadn't started to charge patients, could you have stayed open?
Absolutely not. In the last 12 months, I personally have lost $200,000 supporting my business to try to keep it open. As a practice owner, especially in a rural environment, I've honestly just gotten to breaking point, and I had to be quite honest and raw with my community and explain that if they wanted to keep us operating, that there was absolutely no alternative.
And how's that gone down amongst your patients?
Initially, I think there was some mixed response, but as we've discussed the challenges that we're facing, they've come around and understood. I think the harsh reality is that we're just severely underfunded, and for years, general practice has tried to prop up the system by actually, I suppose, subsidising healthcare for our patients. Instead of asking the patient to pay what we need to keep our businesses open, we have actually foregone that extra income and to support them. And it's come to breaking point. We only get 4 to 6% of Medicare funds per year, and as the backbone of the medical system, it's just not enough. And we were just in a position where we had no choice.
You've also said you've had trouble recruiting GPs. How many other doctors are there at your practice at the moment?
At the moment, I'm the only GP on the ground. I have some telehealth support. We're also working with a nurse practitioner, which is quite new to our team. But being this rural, it's very, very hard to find GPs, and it's very hard to offer them a good enough package to come and work with you. So, and this is part of the challenge. We're competing with the metropolitan areas who don't have enough GPs either. So the metropolitan GPs are trying to recruit with these bigger packages and more financial incentives, and we can't actually afford to offer those packages if we're not charging enough to pay the doctor and to cover our own costs. So you can see how it's just it's a problem that's just amassing over time and space. And sadly, I think we're just at the beginning of the change.
Why'd you say that?
I think more and more practices have just pushed themselves to the same situation that we are. I can't see any future for our recruitment situation to change. GPs are significantly feeling the pinch. We're feeling extremely undervalued. We're constantly targeted in the media as being greedy. We're not greedy. We love our patients. We care about our patients. We just want to be supported and be given the resources and tools that we need to do our job and to support our patients and to keep our businesses running. And I think more and more so we're having to identify what we need to keep the business running as opposed to what the public needs. And we're pushing more and more for the government to take some ownership of that. As I said, 4 to 6% of the Medicare funding per year, that's just not enough. Like, this is crazy. We're the ones that see 86% of the population at least once a year, most times 3 or 4 times a year. We need support to do this job.
So just explain a little more what you need from the government to make life easier for you and your patients. What support do you need? Is it all about funding?
Yeah, look, it really is. It's about giving the patients that have financial, difficulties extra support. Those on healthcare cards, those on concession care cards, they're the ones that need us the most, and they're the ones that are feeling this pinch more than anybody else. We really need to see them have access to extra rebates, not bulk billing incentives like they've had. We want to see them get increased rebates. We want to see those patients be actually offered an opportunity to access us, and even though they pay a small gap, have it be literally a small gap, not a large gap that they can't afford. The Medicare rebate is a subsidy. It's like a childcare subsidy. It's there to subsidise the cost of Medicare, of your healthcare. And we really need to see that increase just to continue to provide the access that we need. The other problem is that Medicare actually encourages us to have short, frequent, quick consults. That's very hard when you're booked out for significant periods in advance. So we often end up spending longer with our patients, managing more chronic disease. And as we spend more time with our patients, the Medicare rebate is increasingly insufficient to cover those costs. So we actually get penalised for putting more effort into our patients if we adjust bulk billing.